Welcome to our Lab Medicine 180.03 Biology of Breast Cancer. And everybody be sure you signed in on this sheet. No, did everybody? Okay. That's because I took it probably. And we have today a great course, and you're going to hear more and more about this. Course topic, Physics and Cancer, just the beginning. We'll expand on it when our course goes on next year. We have Valerie Weaver and Jan Lipphardt, and Diane has graciously agreed to give us an introduction from the advocacy perspective about the Physical Science and Oncology Center grant that was awarded to Berkeley, and Jan Lipphardt is the PI, Valerie is the co-PI, there are 12 centers in the United States, and the whole goal is to try and help really enmesh the understanding and collaborative research between the physical side of biology and the biology side of biology. So you'll hear a lot more about that. I think it'll be a great session.
So I'm Diane Hadizian, and I'm a fairly new patient advocate and a new member on the SWOR this year. And I'm interested in this topic because I never took physics, and I've listened to Jan and Val speak twice now, and it just fascinates me that cancer research is going in this direction. I just last summer took a course called Project Lead, where in a 5-6 day period we get morning till night, just every part of cell biology. They start with us where we are. I was a drama major in college, and bring us through the whole idea of breast cancer research. So as part of our homework before the course, they sent an article called The Hallmarks of Cancer. And I don't know if this is a famous article or not. It was written by a couple people from UCSF, Doug Hanahan and Robert Weinberg.
It's very famous.
Okay.
Weinberg's from White Hat, actually.
Okay, yeah, and then some, right, okay. And, but to me, this was like the eye-opener of all eye-openers, because it said to me that, that we had some kind of a handle on what was going on in the cell. And just like, it's a little reassuring that when you hear that the CIA is monitoring all the chatter that's going on with the terrorists, and they kind of know what's going on, and they're on top of it, I went, oh, okay, so good. We know something about the enemy that's going to help us. And then, and I'm reading about all the mechanisms of the hallmarks of cancer, and then I turn the page and I see this cell diagram, which I've now seen many times since then, and my optimism, it's just overwhelming how much is going on in breast cancer. And we see that every single day. I see it in every DOD grant review that I do, and every Komen grant, and it amazes me as an advocate to see what we have done and what we still have to do. So when I heard about the work that they're doing here, and the fact that the head of the NIH said we're going to take some of this stimulus money and we're going to think out of the box, and we're going to get out of the cell, and we're going to look at the surroundings and see, kind of take some of the brightest people in physics and the brightest people in biology and put them together and do what I think happens, amazing things happen when there's collaborations. That was very heartening to me. So as I said, I've heard them speak twice, and it just, I was not disappointed to see the directions they're going in. I was very heartened to see their initial work is on triple-negative breast cancer, and a lot of my metastatic friends are heartened that they're working on some of those topics. I'm interested. I had multifocal disease, so I'm interested in kind of knowing, well, then why was I stage 1 when it was a huge mass. So I want to know how the forces that are going on in the surrounding the cells talk to the cells and push on the cells and make this thing happen. Because I know the more we know about our enemies, the closer we get to them, the more we can actually get the upper hand, get the advantage. So I offer my help in any way that you need advocates, and I know so does my group from the peninsula. So I'm really excited to hear the work that you're doing now since we last met.
Okay.
Thank
Oh,
you.
that was great. And I would say, what's the saying? Keep your friends close and your enemies closer. Okay, so basically, I'm going to talk about something that our PSOC is involved in, but also just something that I want people to think about, gravity. We all know about force. We know if we jump out of a window, we fall down. That's gravity, right? Basically, it's kind of 101, first thing that we learn in our basic science classes. What we don't realize is that, of course, every day we're actually experiencing forces at different levels. As human tissue, our heart beats. Basically, that's the type of force. The blood's going through our system. That's causing a kind of shear force on our vessels. Every time if we have to take a little bathroom break, that's a stretch force that's acting on our bladder. And so every time we breathe, that actually is stretching our lung alveolar cells. So we walk around, we're putting compression forces on our bones. And then that force trickles down onto every single length scale. And so basically what I'm going to talk about is a lot of this issue of force, how forces are experienced in the tissue, and why that's important in terms of cancer. So to begin with, I thought it would be important to define a few aspects of what we're talking about. So force, or stress, is really normalized load or force per area. And of course, I've got several of my physical sciences fellows in the room, and if I do this wrong, they'll jump on me and tell me the opposite. But it's quantified in pascals, it's a unit of measure, and it's measured as force per unit area, in this case, newtons per meter squared. And so you can imagine if you have a little tiny ball and you hit it against a big building, it's not going to really do a lot, right? If you have a big ball and you hit it against a building, basically that building is pulverized. So that's a really kind of nice way to think about force per area, right? But we're living tissues, and we also experience stress or forces, but we do it in a different way. So if someone comes along and hits you, you feel it, on a tissue, sort of on a growth level, but it's experienced on the cellular level. And the fact is, all living tissue is what's called viscoelastic. So it's not like a building. It's going to be responding in a very unique way. And so when we talk about viscoelastic, we're both elastic and viscous. So basically, you imagine elastic as if you take a rubber band and you pull on it, or if you take, this is elastic man, you pull on him and he snaps back. Well, we're obviously not, elastic man. We're, more than elastic man. We're viscous. We pull out, we are elastic to some degree because we can pull on ourselves, but we're also viscous, but we're not completely viscous or goof man, because basically, otherwise you couldn't sit in your chair. So we're a combination being viscoelastic, and this really has some relevance with respect to how we experience force and how that actually could impact on our behaviors. So I thought it would be really important to kind of understand stress and force per area, just for those, and bear with me, those individuals that actually know this really well. So just think about the idea of like walking around skating on thin ice. These guys are on some really thin ice. So basically, if you're standing up and you walk around on thin ice, basically all that force is coming down and it's concentrated in a very specific area. And the net result is that a lot of times you're just going to fall through. If you distribute the force differently, right? So here's a penguin. Basically, these ducks, they have webbed feet, and they have obviously less mass, but basically they can dissipate the force. You can lie down here, like here, and so basically you're not going to fall through the ice the same way because the actual distribution of that force is different. Am I doing okay, you guys? Good. I'm getting like some good nods there. Okay. So I think that's important to actually tuck that in the back of your mind for those individuals that are not accustomed to thinking about that. I would say that, as I mentioned, every single cell in your body, every organ, every tissue experiences forces, and there are all kinds of different types of forces. And when I talk about going across force, like length scales, what I'm talking about is walking around and putting compression loads on your bone. I'm talking about your heart beating and the blood flowing, which gives you a kind of